So hello again and welcome to another Horizon Scan. And today we're talking to Dr. Yardley Jones, who's an expert in occupational health. And we're trying to find out more about COVID-19 and what it holds for the future. And this is something we all think about, but for business decision makers, we need to know something more about the backdrop and where this is all going over the next few months. So Tony, we've got vaccines now. Surely it's all over, isn't it?
Wouldn't that be so simple? Peter, as you know, the issues around vaccines, on the one hand, certainly in the UK and mirrored in other countries, there's a rollout of the vaccines. What is now beginning to appear is that the efficacy of them in the light of the new variants which have actually been found. And this morning, for example, was the news from South Africa that they have delayed, if not abandoned temporarily, the rollout of the AstraZeneca vaccine because of some data that they have, albeit not peer-reviewed, that shows that the efficacy of it, certainly in younger people, for relatively non-serious disease is actually not that effective. Now, I haven't seen the data itself and it hasn't been peer reviewed, but it has caused South Africa to halt the AstraZeneca. And my feeling is that may actually then give concerns for the rest of the rollout of the AstraZeneca one, albeit the South African variant in the UK doesn't seem to be that prevalent at the moment.
There seems to be a mismatch between the mutations which happen at the drop of a hat in a very short time frame and long timeline to issue a new tweaked vaccines. How does all that
work? Well, it actually doesn't, because you're always to a degree playing catch up with vaccines compared with mutations within virus. And flu is a good example of that, in that's why flu changes. Its mutagenicity, its infectivity, and that's why we end up with different batches of vaccine every year, depending on actually what the best guess of the WHO is as to what vaccine is actually going to come from the Far East, which they normally do, into the West. COVID actually is more challenging than that, in that it appears the rapidity of the variants which are appearing, which when these vaccines actually were developed, all of them, they actually were looking at the data on the current COVID 19 that was around at that time. Then some variants came in where the belief was that the vaccine was broad enough to cover those variants. But actually, many virologists, I think, were a little bit skeptical to say that eventually the virus will produce mutants and changes where the vaccine may not work, because the vaccines are relatively specific, most of them for the spike protein, as you know. So the reality is, and I think AstraZeneca is a good example, where they are now already thinking that they need to ramp up to have a broader spectrum of effectiveness to compensate for the fact that new variants are the reality in this very interesting, fascinating, and changing virus.
So, I mean, as I understand it, mutations can occur in different parts of the viral structure and change different aspects of the way it works. And the first mutations that were identified seem to make the virus more transmissible.
Correct.
But the later variant mutation that's been discovered, it is actually giving the virus the ability to defend itself against the vaccines that have been used. That's a different aspect of the virus characteristics. Are we doomed to different variations acting on different parts of the virus as time goes on. I think we are, aren't we?
It may be quite possible that, Peter, and it will be a challenge to the scientists because they've done a great job, as you know, in terms of from the start when they actually did the sequencing of COVID-19 to then looking at the mechanism and then actually to produce a vaccine in an incredibly rapid time in terms of all the phases that they had to go through. And I think there was a learning curve that they went through with an optimism in terms of some of the efficacy data that we had. You know, having a vaccine which is 90% or between 70 to 90% effective is virtually quite unknown, but it's quite rare.
Well,
So there's a lot of
several.
optimism.
We got several of them at that level of efficacy.
Correct, and they all rolled out around the same time. But of course, now is the worry and to some degree pessimism that the variants are actually requiring the scientists to rethink as to how they tackled this by actually modifying the vaccine following what actually the variant is. Now, it may be that they may be able to predict which variants might be in the future, but I actually don't know enough about actually that level of thinking. And of course, as we've always said, it really depends what the virus does and where it does it and to who.
So it's fair to say then, is it, that vaccines do change the picture, but they only give us some weapons to use. The mutations change the outlook, but not from what was expected in fact, because viruses always mutate.
Yes, I think there was, I mean, it was acknowledged that there was an expectation that COVID-19 would change and new variants would occur. I'm not so sure that they actually expected it to happen so quickly and so broadly.
So, sorry to interrupt, Trainee, but I know that you've been marveling at this virus, if that's the right word to use. You've always felt this from the very early days, that this was really quite an extraordinary virus. Could you just give us a sense for that?
Well, I think it actually is it's caused syndromes in terms of disease, which we actually haven't seen before, and it varies in different age, as you know. And it also has a prolonged effect on individuals. Some individuals don't have any symptoms at all. Some people have mild symptoms. Some individuals have very, very severe disease with some underlying conditions that might be associated with that, depending on how it actually attaches to the receptor. And that really confused and challenged the health sector very early on. But things actually have got better in so much as there's a recognition of actually monitoring people sooner, not putting people on ventilation as quickly as they did before. Now, when you think about it, we haven't known about this virus for that long. It's what, just over 12 months. And so therefore, but it continues to challenge. We have some medications that can actually be somewhat effective in terms of looking at the immune response, which actually is triggered in some patients. And I'm not on the front line of this, but just looking at from the biology of this virus, it is actually quite remarkable as to the effect it is, and actually is still ongoing in some individuals, things like long COVID, which is actually going to be, I suspect, from employers, a real problem when people are going to find it, they are still having a degree of some vague symptoms, which are rather difficult to treat and to manage and sometimes recognize.
And
quite a
and so I guess then for the next few months, what happens after the first wave of vaccinations? Do we, the old and vulnerable are being vaccinated as we speak, then what?
Well, I think the experiment is on in a way because the data will now be collected as to how effective the virus is compared to the original phase 3 trials. Of course, what's happened is the new variants and the effect. It is the effectiveness of those vaccinations, because, as you know, it appears that a more delay than they thought initially of the two doses actually has a big effect. But it looks as if actually they are now already thinking and accepting that the variants are actually going to increase, or
Mm,
they expect it to, and they need to be prepared that there may be a third dose, whether that is a top-up dose or whether it is a revaccination, in other words, of the two dose from a rather different vaccine, is something I don't know at the moment. But that might happen. So it may not just be a top-up. So vaccination, yes, has been hailed as the game changer, but it still doesn't replace. The vaccine spreads between people and people, and the thing is that the social distancing and all the separation and all the things that we're going through is still going to have to be around, I suspect, for a lot longer than people think.
so let's say we protect all the old and all the vulnerable, just for the sake of argument. Who are the people that seem to be at the forefront of vaccines and and so on. What about the people who are not old and not vulnerable? Does the virus have any implications for them?
Well, this is where the challenge is that there are people who uh, carry this virus with no symptoms, and they don't know about it. So testing was aimed to actually pick that up. And as you know, there's quite a bit of testing going on now to look at actually the new variants. Um, so the plan is that or the view would be, if everybody's vaccinated to protect them from severe disease and hopefully infection, then that's an end to it. I don't see that. I think it's just going to be an evolving situation of vaccinating the majority to prevent serious disease and protect the health sectors and service so that they can cope with a certain number. But actually, the virus is actually still going to be around, I think, for a lot longer than people expected. I think the virologists always thought that it was going to be around, and there may be another one. I don't know, Peter. So it looks as if the world is going to be very different in the future to cope with. So once vaccination is a game changer, uh, as it's actually being rolled out, the worry I have is that people will think that this is actually the absolute solution, and I don't see that.
Because it seems to me that if we sort out, in inverted commas, the old and the unwell, the vulnerable, let's say,
Yes,
that's going to begin to reveal the impact of the virus on people of younger generations, and in particular for business decision makers, that's
yes,
staff and customers.
yes,
And some of those are already extremely nasty. And one mutation I'm worrying about is the ability of the virus to be uh, to have a greater impact on younger people. I think
yes.
that would be a really worrying development, wouldn't it?
Yes, on the basis that when all this started, the elderly and the vulnerable in terms of underlying conditions were the target and the cases which are increased. That has changed this time during this lockdown, where there's been a younger population uh, in being hospitalized with some serious outcomes. But also the persistence of some of the symptoms in younger individuals at the peak of their working age uh, which is actually causing vague and really very difficult symptoms to manage, such as fatigue, some cognitive dysfunction, and that's on top of such individuals having had to change the way they work in working from home, not being able to travel, and all the mental health issues there. So it gets very complicated and very challenging for businesses, given that the expectation is when we get back to normality, whatever that will be, we then have to manage expectations of employees, and how we accommodate some of the long-term effects uh, of this virus.
So, so the three things then that we are going to have to learn about is number one, the game may change at any moment due to new mutations, and probably will.
Yes.
Number two, vaccination isn't a one and done or even a two and done. We're probably going to have to work out how to live with certainly routine, if not frequent, vaccination, and possibly in younger and younger people,
Possibly.
with all the disruption that may bring, and thirdly, I suppose, how do we manage around all the complications and restrictions and changing circumstances that may come as a result of all of that, because it doesn't seem to me that there's anything likely in the next few months that's going to remove all of that. It's going to be something we're going to have to live with.
I agree with you, Peter, because some of these discussions around when people do come back or are coming back, do organizations mandate that they've actually been vaccinated? What's the duty of care there for them, and also for employees who may not want to be vaccinated for all sorts of reasons, protected reasons? What about the testing of people in organizations to make sure that they are not the asymptomatic people who actually may be able to sort of spread it to those people who haven't been vaccinated or who have? And the legal implications of all that in terms of, the Health and Safety at Work Act, the Equality Act, and it's going to be very difficult. And having sort of spoken to quite a few people around this subject, I think the challenges will be how they're able to cope with that and run the business and satisfy people's expectations and accommodate those people who may be, for all sorts of reasons, not wanting to come back to work, can't come back to work, or have a different way of actually working. And I think we're seeing some of those now, but at the moment, I think we're all into the vaccine and hope that that will actually be the solution. But I think it's going to be, very difficult, Peter. And actually, I don't know the answers. I actually don't know the answers.
So the new world, the new normal, if you will, it is not actually anything more than an extended period of what we've got, which is some sort of restrictions that come and go, mutations that come and go, and vaccinations that come and go.
And then, of course, there's the behavior and how people behave with those restrictions and guidance, and whether they'll just get tired of it all. And I think we've seen some of those behaviors evolving, and I think it's the same actually in other countries as well. The other thing that I'll be interested in is actually the rollout of the different vaccines and how different countries are going to acquire that. And if you look at Europe at the moment, and the French and the Germans, and how have they been actually deciding scientifically which vaccine they should actually approve. Now, how that's going to pan out when you actually get newer vaccines because of the newer variants coming on, it's going to get very complicated, I think.
Isn't it? And it's going to make movements of people and borders and all of that's going to be shifting quite quickly. I mean, I was just thinking of going on holiday for 2 weeks. The chance of having stable borders over a period of 2 weeks probably is not there, or not there for some time.
Well, it's actually changing almost by the hour. And then there is the vaccine passports, vaccination passports, and the efficacy of that. And how's that going to pan out? How do you validate it? How do you test for it?
And that's it. That's assuming you've got a vaccine that people believe in, and if country A believes in a vaccine but country B doesn't, what does that say about your passport?
Correct. And that's just, just something sort of milling in my mind at the moment is how do you manage that, and have you had the right vaccine? The other thing, having had the vaccine myself last week, is that if there's publication that the vaccine you have isn't quite up to scratch compared with the other one, is that you give people a choice. I just wonder whether that's going to start.
Doesn't that's going to make record keeping incredibly complicated. If you've had the XYZ vaccine version 12,
yes,
that means that you're going to need some sort of booster at a different time and of a different kind than somebody else. And how on earth do we track all that lot?
Well, it'll be recorded. Hopefully it will be tracked. But actually what the implications are, at the moment, they're looking to see whether you can mix and match the vaccines depending on availability, possibly preference. And that data isn't around yet. I just think it's going to get more complicated that if you've actually got variants with different vaccines, that may not be there. So going back to the comment I made, not for the reason behind the variances, we're going to end up with different vaccines at different ages and probably at different times, depending on what the virus does. Going back again, it's the virus that's leading this.
Absolutely. So just to wrap up then, Tony, here's the key question. Where will we be next autumn and winter? Will next autumn and winter be different from this autumn and winter?
What I am confident about is that science has learned a lot very rapidly in the last 12 months. And the technology that is now available does give us a chance actually to be possibly one step ahead if there is a pattern to the variants which is coming. And there might be then. I'm not a virologist, but it is actually one of the hosts we've got, probably supported by actually newer novel treatments of antivirals if they are coming, although that hasn't been really very spectacular, it would seem to me, albeit I'm not in the front line. But there's no doubt that this is a very serious disease in some people. In others, it isn't, which actually causes a problem because they may spread it. So I am pessimistic that this is not going to blow away in the summer, in that the virus won't be around in the summer. We may be in the same situation again, despite the fact we have vaccines. I might be wrong. I hope I am.
Well, if nothing else, it's an extraordinary situation, and I guess for business decision makers, it's a question of what you've got now is the unfolding situation where change is frequent, change may be rapid, but it'll be some variation of this for some time.
I would go something like this, Peter, is that the situation will change. There'll be an increase in uncertainty and predictability and the speed of it.
Seek to end this this on a positive note. I think I draw two positives out of this. The first is that science has learned an enormous amount extremely quickly and turned it into something practical in a blisteringly short space of time, which is just brilliant. And we're going to need to continue to do that.
Yeah,
and
no doubt about it.
The second thing I think I would say by way of a positive is there has been immense global collaboration and open collaboration at that. I think those two things together give us some hope for the future. Tony, thank you very much indeed for your time.
Thank you, Pete, as always.
And maybe we'll have another discussion on this subject, I'm sure, in the not too distant future.